get started with our presidential inauguration. But first, we have to say goodbye to one MMA president before we welcome another. Each year, we choose one of our committed, engaged, and enthusiastic leaders to serve as our president. This person is the principal spokesperson for the MMA whenever media calls, when we need a leader to testify at the Capitol, or whenever a physician voice is needed. I'd like to take a couple of moments to honor our outgoing president, Dr. Laurel Reese, and thank her for her service to our association. This year, we kept Laurel very busy. She testified on behalf of the MMA multiple times at the Capitol, and if you did not get to watch her testify, you should find that because she's amazing. She also testified on prior authorization as well as other legislative priorities. She also served as MC at our very well-attended Physicians' Day at the Capitol. She met with leaders at clinics and hospitals all throughout the state, listening to physicians' concerns and emphasizing the importance of involvement in our association. She was active in the American Medical Association, attending several meetings across the country as an MMA representative. In addition to her work at the Capitol and with the AMA, Laurel represented all physicians in the state by talking to the media on diverse topics such as prior authorization, workforce issues, fireworks safety, and vaccinations. She has been an outstanding representative of what we stand for as we proudly represent the best interests of physicians, physicians in training, and their patients across the state. Thank you, Laurel, for all of your hard work. It's been an honor to have you as our 157th president.
Thank you, Kim. It's an honor to stand in front of everybody here today. This morning, I had a typical physician situation. My children stole my cell phone this morning, and I had a routine hospital follow-up as my last patient of the morning. Hence, I'm late. Because y'all know how those routine hospital follow-ups can take a left turn. So I took great care of that patient and came when I could. So thank you for putting up with me being a little tardy today, but there's my priorities. Physician leadership is different than leadership in other organizations. Other organizations, you have the leader on the top, and they're supported by a pyramid of people who report to people who report to. In healthcare, we turn that upside down, and the most important people are the patients. And we support the patients. And the Minnesota Medical Association supports the physicians and the patients. So it's been an honor to be in that position where we could make a difference for patients and physicians in the state of Minnesota. And it started, we listed accomplishments, but those accomplishments really started with listening, understanding what physicians need, understanding what patients need, really trying to figure out where we could best leverage what we have to make a difference. And it's been a year of accomplishment. I mean, we passed some of the best prior authorization legislation in the nation. Partly that makes a difference for our patients. That makes a difference for our physicians. We passed legislation to support physician well-being. We have programs for physician well-being. But the things that we heard, the things that we know to be important in our community, we addressed those things and we made a difference. The good news, though, is I left some work for Dr. Bogonko. Actually, the real reason I was late today is I was holding onto this medallion and it wasn't it's an honor to pass the medallion on to Dr. Bogonko. I keep thinking of what a phenomenal job he's going to do in this role. And I'm really excited for all of your adventures in this coming year as we work together, all of us work together to continue in that work. So now I'd like you to come join me up here. And while he's coming up, I'll tell you, my support team brought me my phone. So if you noticed a phone wander in here, that was my hospitalist husband who brought it to me today because he retrieved it from wherever the kids put it and brought it in. So that's my support person. We have a great support team. And I noticed that you also brought your support team with you today. And I think that's just wonderful. All right, I'm going to take this thing off now. It is my honor of presenting Dr. Edwin Bogonko with this presidential medallion as the 158th president of the Minnesota Medical Association. You can put it on. Dr. Bogonko is also a hospitalist, like my husband, and he's a hospitalist at Allina Health in Shakopee, Minnesota. He's been very active in the Minnesota Medical Association since joining the organization in 2010. He served as the chair of our board of trustees from October 2020 until 2023. There were some things going on in COVID at that time, if I recall. He served on the Minnesota Medical Association's executive committee, policy council, nominating committee, and awards committee, and he served on finance and audit. Congratulations, Edwin. We look forward to your year in office.
I think it's fair to say sometimes people say things about you and you look behind and say, who are they talking about, right? So thank you, Kim, for an outstanding job. First, let me begin by acknowledging the excellent work of our outgoing president, the amazing Laurel Reese, in showing up in the past year on behalf of Minnesota physicians, patients, and for the health of all Minnesotans. In particular, at least I was extremely delighted to see her testify in front of lawmakers. I know you made a difference because the legislation got passed. Nothing is better than the stories that we tell those that pass the laws. I will leave your shoes alone, I think. So let's give her a hand. She did to the past presidents who have served the MMA, if you're here, you can stand. Thank you. These and many others have given us 170 years of service and great work that we strive to continue. To my family, thank you for your undying love and support in this journey of service. It humbles me every day. I remain eternally grateful. To our talented MMA board, staff, and our membership, thank you for the honor of serving as your 158th president. I look forward to working with you in the coming year as we continue to make Minnesota the healthiest state and the best place to practice medicine. I am both excited and humbled to take this responsibility. The association has done great things in the more than 170 years of its existence, and I don't plan to do anything different. That tradition will continue.
I think you turned it off.
Okay. So you can be assured that over the next 12 months, I will give my all as the MMA works on the serious issues that face medicine in this land of 10,000 leagues. Issues such as work limiting the abuse of prior authorization by health plans and pharmacy benefit managers, limiting changes to formularies, media through contracts with patients, promoting physician wellness, increasing Medicaid patients, especially to our physicians in our rural parts of the state. And we have to continue to advocate to preserve the healthcare networks in our rural areas of Minnesota because our citizens deserve to get care close to home. In particular, I plan to focus my presidency on issues close to my heart. As many of you in the front lines will agree, expanding access to mental health care is really crucial to easing the choke on our systems, both as physicians, even our health organizations, our hospitals and clinics, and especially our emergency rooms. I also would like to continue protections for seniors. We need to advocate for an environment that does not force seniors to choose between paying for medicines and putting food on the table. Recent federal limits on medications such as insulin have gone a long way in helping move that work along. I think as we call our legislators and all our healthcare policy people, we need to be at the forefront of advocating for our seniors. And as our state becomes more diverse, the MMA will continue to lead in matters of equity and justice in healthcare. I'm hopeful that more of our communities will be encouraged to motivate and mentor their kids to pursue healthcare careers, including going to medical school. We know a physician and workforce shortage in general is something staring at us. It is not easy to solve. We have to do our best to raise the alarm and get our young people interested in medical careers. A healthy community will always be the one whose caregivers reflect the diversity that enriches us all. Most of all, I will champion the ideal of taking care of each other. Physician burnout, if you've experienced the loss of a colleague or a classmate, you know what I mean. We need to check on each other because that's the most important duty. So for the past 36 years, I have always believed in respecting and serving my profession that has given me so much. So I want to conclude by invoking the words of Martin Luther King Jr. Life's most persistent and urgent question is, what are you doing for others? He went on to say that everybody can be great because everybody can serve. Thank you all for serving, and please invite others to serve as you are. We can all make a difference. Thank you.
Edwin, I know you're going to do a great job this year. Let's give a round of applause for Dr. Edwin Bogonko. And now, I'd like to invite everybody to first thank you for attending our brunch, and invite everybody to go to check-in. It's up the stairs, at the top of the stairs here. Check-in starts at 12:30, and the conference will begin at 1 o'clock. Thank you all for coming.